Good morning. My name's Lynn Fox, and I'm an emeritus professor at Portland State University. I've been practicing in Portland, Oregon for almost 30 years now in various healthcare settings and doing research in augmentative and alternative communication. But my passion from the beginning of time has really been in looking at motivation and how we use motivation and motivational theory to help our clients change and to maximize the outcomes of their therapy. There's a growing body of research that tells us that self-determination and autonomy are two of the most important key issues that help our clients achieve the best outcomes. Doesn't seem to matter if we're talking about acute care hospital, long-term care, occupational therapy, physical therapy, speech-language pathology. All of us in the rehab field, the findings are pretty strong now that these factors are as important as anything else that we do. So the focus of my talk today is going to be on how we can maximize our clients' motivation, their self-determination, their sense of autonomy. And to do this, I'm going to be using 3 case studies to illustrate the principles that I'm going to be going over with you today. The first case study is a case study from my own practice, a client that I worked with at a residential care facility who was learning to use an adapted email program. He was kind enough to give me permission to use the video examples that I recorded during those sessions. And I was lucky enough to have the support of his clinician, Lisa Stember, to help kind of make that partnership work in that residential care facility. So that's going to be the core of the presentation, that case study. I'll be showing you 3 different video clips and talking about each of the principles that I cover in relation to that video. 2 other case studies that I'll present at the end were generated by clinicians in this community in Portland, Oregon. Clinicians who have taken my classes in counseling in communicative disorders and who are now in practice out in the community. So the kinds of techniques that I'm going to be talking about today are not new. Solution-focused practices have evolved over the past 30 years. The solution-focused model that I'm presenting today is a blend of principles from the field of counseling and speech-language pathology. In the 1970s, the whole notion of a solution-focused practice first began. The initial model was developed by a counselor by the name of Steve DeShazer, and DeShazer is recognized as kind of the founder of this model. He coined the term solution-focused brief therapy for his model, where he looked for meaningful changes in the client's behavior, meaningful changes within the client, kind of looked at what the client already brought to the table and then tried to maximize those changes. So DeShazer didn't see the counselor's role as being the role of the change agent, just the change facilitator. And that's kind of the process that we're going to be looking at today. Those early ideas of DeShazer's in the counseling field were adopted and modified by 2 of my colleagues, Jim and Mary Andrews, who for 25 years ran a systemic, family-based treatment program at Northern Illinois University. And they experimented with various solution-focused techniques, and they've been writing for 25 years now on that practice. I was lucky enough in 1998 that the Andrews came to Portland, Oregon, that we began working together, doing research and publishing in this area and presenting in this area as well. So our focus since about 2000 has been in looking at how these techniques can be beneficial in partnering with clients who have neurogenic communication disorders. That's going to be my focus today when I talk to you.
you.